Anya Jastreboff and Darren McGuire, Mike Gibson coming to you with This Week in Obesity. Darren, talk to us about where we're at with oral semaglutide in the SOUL study.
Yeah, so I've co-chaired this SOUL trial with John Buse and an executive committee, been very dynamic over the last 7.5 years. We've been working on the SOUL trial. It's oral semaglutide versus placebo in people with type 2 diabetes who have atherosclerotic cardiovascular disease or high risk for it with CKD enrichment. The press release top line results have been made public. We unblinded and got the initial cut of results about a month ago. It's almost 10,000 patient trial, over 3 years of median follow-up. And we were able to demonstrate a 14% relative risk reduction that's statistically significant with oral semaglutide versus placebo. And so again, like all of the other placebo-controlled type 2 diabetes therapeutic trials, this was done on the backdrop of best available care, titrating open label to treat glucose, so we weren't placebo controlling glucose. All of the other cardiovascular risk factors were pretty impeccably controlled. So high intensity statin use was highly prevalent, ACEs and ARBs, antiplatelet therapies. So these patients and blood pressure and LDL cholesterol, these were all really well controlled. And on top of all of that, a 14% relative risk reduction. We haven't seen the details of the data. That's simply from press release. The one other piece of data the company included in the press release was that almost 50%, 50% of participants in SOUL at one point or another were treated with background SGLT2 inhibitor. So we will have the best stability of any trial to date looking at the two drugs in combination. It's not randomized to SGLT2 inhibitors or not, so we'll have all the limitations of an observational analysis. But as we've seen more and more and more background use of SGLT2 inhibitors in the GLP-1 trials and vice versa, we've not seen any signal of differential treatment efficacy. So in the absence or presence of the other agent, these drugs still work. And so the take-home point from that, and we included this in the European Society of Cardiology guidelines last fall, is that we believe that each of these classes have a level 1A indication, both to be used, not either or. And that's independent of blood glucose, independent of whether metformin is being used or not, and independent of A1C targets. So we'll look forward to seeing the SOUL drill down results, but it's another positive GLP-1 receptor agonist trial, and this will affect a lot of people who are just afraid of those tiny, tiny little needles. The injections are no big deal, but there are people who just refuse to consider. So this will open up a whole new opportunity.
The other problem, and thanks for reminding me, Darren, I was supposed to take my PCSK9 inhibitor a day or two ago, and I forgot. I mean, it sounds great to have, a weekly or monthly injection, but I got to be honest, I forget them. I never forget to take my medicines in the morning. So the two of you, Anya, what do you think? I mean, do you see a good niche or role for the orals?
Yeah, I definitely see a good place for the orals. I think it really depends on the patient. So there are patients like you who like to have, I don't know if you have a pill box, but my patients who like taking medicines in the morning when they're brushing their teeth, they have their pill box and they fill it every Saturday or Sunday and they take it every day and it's part of their routine and they really like that. And then I have other patients who love being able to take something once a week and not having to think about obesity and or diabetes, right? Well, diabetes is a bit different, but their obesity, they take 30 seconds once a week and that's it. They're good to go. And now we may have options where, there may be a monthly option. So the way that I have patients remember to take medicines, so sometimes we space out the weeklies every 10 days, right? For some patients, they do better with that. I say, okay, take it on the 10th, the 20th, and the 30th. And they'll put reminders on their cell phone or on their calendar or whatever they use. And I think with a monthly option or less frequently, it could be the same kind of thing. It would be the 1st or the 15th or whenever you pay your credit card bill. That's the day that you take your medicine. I often have people pair things that they're already doing, and then that builds the habit.
Yeah, I'm in the habit of, brush my teeth, take my medicine. That's
Yeah.
my habit. But,
That's
it
habit.
comes up on my Google Calendar, take your shot. And I get so busy. I'm like, yeah, I'll do that. And then I forget. So,
Well,
You gotta
let's
pair
do,
it with something else. You gotta pair it with something else that
yeah,
you, yeah.
yeah, and let's dive in while we're having this conversation, dive into the detail, especially for a cardiology audience who may not be used to prescribing oral semaglutide. This is a very unique tablet formulation, and the drug is delivered only where the tablet sticks to the gastric mucosa, and it's only 0.8% bioavailable. So 99.2% of drug is excreted in the feces. To do this right, you have to take the drug with no more than 4 ounces of water, the tablet, and nothing else at all for 30 minutes. Now you can get up and around and you can take your shower. You don't have to stay still, but you can't eat or drink anything for 30 minutes to get the biggest bang for your buck out of that tablet that is so horribly inefficient at delivery. But this tablet won international awards. It's the first time we've been able to get a small protein past the stomach. And so it's a breakthrough, but it's highly inefficient and to get the best effect, both for glucose control, possibly for weight loss, and for cardiovascular benefits. I think it's important to know how to take the tablet.
so my oral semaglutide, shower, brush my teeth, and take my pills. Got it.
Yep. Yep.
And separate it from, I guess, your anything else that
Proton
might.
pump inhibitors and
Exactly.
everything pretty
Oh,
much.
really?
Right?
So PPIs collide with it?
But
Is
yeah,
that,
I don't know how much we know about the absorption interactions, but I
see.
think it's encouraged to try not to put anything else into your mouth or stomach while the tablet's marinating on the mucosa.
All right. Well, I learned something from you too every time. Thanks for joining us. Thanks to all of you for joining us here on This Week in Obesity.